Let's talk about running back for the New York Giants, Saquon Barkley, and his high ankle sprain. So a few weeks ago, Saquon was playing in a game and he suffered what they determined to be a high ankle sprain. So what I want to do is talk a little bit today about what a high ankle sprain is and why it's a little bit different than a traditional low ankle sprain or an inversion or lateral ankle sprain. So in a more traditional lateral or inversion ankle sprain, typically somebody will be running and they'll plant and they'll roll their ankle inward and they'll end up injuring the outside of their ankle. In an incident with a high ankle sprain, what we find is the exact opposite happens. The person, or in this case, Saquon, is planted, and what happens is his ankle gets rolled outward. And so what that does is that puts a lot of pressure on the inside part of the ankle, and more importantly, a structure across the front of the ankle that we'll talk about here in a minute. So this is an x-ray of an ankle looking straight on at the foot and ankle. What we see is that there is a small bone in the center of the ankle called your talus. And then we have those two knobs at the bottom of your ankle, one on the inside and one on the outside. And what happens is that talus sits in the center almost like a wrench would. And what we typically describe is those two bones, your tibia and your fibula at the bottom, are kind of like two chopsticks. We want to keep those two ends close together. What happens is there's a small membrane that runs up the center of it called your interosseous membrane. And that's highlighted in this picture in blue. And during a high ankle sprain, what happens is those two chopsticks slowly get spread apart, and that ruptures or damages the interosseous membrane. So the difficult part about a high ankle sprain is that there's a lot of pain associated with this. That blue interosseous membrane continues to split every time the athlete attempts to walk or put weight on that foot. So a lot of times what we'll see is that the athlete will be placed in a walking boot or even sometimes crutches, depending on how painful it is every time that they take a step. In terms of recovery and return to play, an average timeline is around 6 to 8 weeks, depending on, the nature of the injury, how severe it was, as well as how far up that interosseous membrane the injury occurred. The other thing that we're also thinking about is the demands for that sport. This is very difficult for somebody to come back from if they do a lot of pivoting, twisting, cutting, things like that. So running backs, cornerbacks, safeties, basketball players, soccer players, they're going to require a lot of planting and pivoting around there, which is going to further stress that interosseous membrane that's trying to heal. Again, the biggest thing that we're thinking about, though, is how painful somebody is when they're walking, how painful they are when they run, plant, twist, things like that. So a lot of this is symptom limiting. And then sometimes we'll see a repeat x-ray when we're thinking about getting the athlete and clearing them and getting them back to sport. And so sometimes we'd like to take another x-ray to see if there's any more widening of the bottom of that ankle, widening of that interosseous membrane that we talked about earlier. And sometimes that can help to determine whether enough healing has occurred, especially if the athlete's a little bit tougher and maybe they're really trying to push through pain as well. Then what we'll do is we'll put them through a battery of different pivoting, cutting, agility style exercises to make sure that they're strong enough, confident enough, not painful enough when they go to push off on that side. If they still are, we're still working a lot on foot intrinsic, so being able to grip the ground. That will really play a big factor into some of the planting, twisting that an athlete needs to do. The other thing is that we need to strengthen the calf muscle as well as the muscles on the sides of the ankle, so the muscles that turn your ankle out and the muscles that turn your ankle in. And then the other thing that we're also looking at is a lot of hip strengthening to make sure that when somebody plants and they go to push off, that they're able to use the outside and the back part of their hip to assist their foot and their ankle to really give a good push off during that change of direction maneuver and to make sure that that's not painful. So Saquon is potentially going to play this weekend. We'll keep an eye on him as well as what the New York Giants sports medicine staff have to think about his readiness and his determination to play this weekend.